Anxiety ICD-10 codes look simple, but defaulting every client to F41.9 unspecified raises red flags and exposes your claims at audit. Reaching for the unspecified code on every anxious client can suggest incomplete assessment and payer's notice. Anxiety disorders live in the ICD-10 CM F40 to F41 block. Here is the documentation and billing reference for owners, billers, and operators. We cover the common F40 to F41 codes, the documentation that supports them, and the audit risks of getting them wrong. Anxiety disorders fall under ICD-10 CM category F40 to F41, phobic anxiety disorders, and other anxiety disorders. F41.1 is generalized anxiety disorder. F41.0 is panic disorder. And F41.9 is anxiety disorder, unspecified. ICD-10-CM has been the required U.S. diagnostic coding standard since 2015, and it is updated every year. The code you select should drive every goal, objective, and intervention in the anxiety treatment plan that follows. An incorrect anxiety code can lead to denials, payment delays, and recoupments, and coding mistakes scale fast across a caseload. In one compliance case, the Office of Inspector General identified coding errors by a psychiatrist that led to over $1.1 million in overpayments. As behavioral health volumes and audits rise, organizations that consistently miscode anxiety face higher denial rates and payer scrutiny. A generic medical EHR won't flag overuse of unspecified anxiety codes. Behave Health's diagnosis module is built for behavioral health workflows. The diagnosis module highlights F41.9 as unspecified and nudges you toward a more specific F40 to F41 code when the documentation supports it. If a code is incomplete, needs more characters, or has been retired, the system is designed to prompt a correction before submission. 5 codes in the F40 to F41 block cover most anxiety diagnoses you will bill. Picking the right one is a clinical and an administrative necessity. Let us walk through the 5 you will see most. Code 1, F41.1, Generalized Anxiety Disorder. F41.1 covers persistent excessive worry across multiple domains for at least 6 months. Document the worry, its duration, and symptoms like restlessness, muscle tension, and insomnia to support the code. Code 2, F41.0, Panic Disorder. F41.0 denotes recurrent unexpected panic attacks and fear of future attacks. A note that just says the patient was anxious won't support F41.0. Document the panic attack symptoms and the fears of recurrence. Code 3, the F40 phobic anxiety codes for anxiety tied to specific triggers or situations. F40.10 is social phobia, unspecified, and F40.00 is agoraphobia without panic disorder. Reach for the F40 codes when the anxiety is tied to a specific trigger, like social scrutiny or open spaces. Code 4, F41.8, Other Specified Anxiety Disorders. F41.8 is for a specific anxiety presentation that doesn't have its own dedicated code in the F40 to F41 range. It lets you specify an unusual or mixed presentation instead of defaulting to the generic unspecified code. Code 5, F41.9, Anxiety Disorder, Unspecified, also known as Anxiety NOS. F41.9 is a billable code appropriate when an anxiety disorder is present but not yet specified, such as at an initial assessment. Once you gain clarity, move to a more specific anxiety code rather than leaving F41.9 in place. Beyond overusing unspecified, a few recurring mistakes drive denials and audit findings. Don't use symptom or context codes, like R or Z codes, as the primary diagnosis. Your primary code should come from the mental health chapter. ICD-10-CM updates every October 1st, and billing a retired code leads to rejections. Adjustment disorder with anxiety should be coded F43.22, not the generic anxiety code, F41.9. Auditors and payers increasingly look for a clear link between the coded anxiety diagnosis, the treatment plan goals, and the progress notes. The chain should run from assessment to the ICD-10 anxiety diagnosis to a treatment plan goal to progress notes documenting that goal. If you bill F41.1 across 40 sessions, an auditor expects notes that show work on generalized anxiety, not just that the client talked about their week. Behave Health is designed to tie the anxiety diagnosis to the plan and the notes, so the medical necessity through line is captured as the work happens. The code library is designed to update annually, so retired anxiety codes simply don't appear as options. Diagnoses are listed by DSM-5 name and paired with the correct ICD-10 CM code, reducing miscoding from naming differences. The platform is designed to associate each treatment plan goal and progress note with a specific diagnosis, producing audit-ready charts. Stop defaulting to F41.9 and exposing your claims at audit. Book a 20-minute demo at behavehealth.com. See anxiety codes, DSM to ICD mapping, and diagnosis link documentation built for behavioral health at behavehealth.com.